Good evening, ladies and gentlemen. It is my privilege today to welcome and introduce Dr. Pranav Pandya, who is present here to talk to us on the important issue of stress management. We are indeed fortunate to have amidst us an iconic personality whose discourses in the country and abroad have enlightened all strata of the society on spiritual aspects of Indian culture. Dr. Pranav Pandya is a gold medalist in MD from the US Medical Services in 1975. He gave up his job with BHEL as the in charge of ICU cardiology and joined the Yug Nirman mission at Shantikunj as the director Brahm Varchas Research Institute in 1978. Under the noble guidance of his guru, Pandit Shriram Sharma Acharyaji, he laid the foundation of pioneering work in bringing science and spirituality together. He wears many hats and is the director and head of all World Gayatri Pariwar, director of Brahma Varchas Research Institute, chancellor of Dev Sanskrit Vishwavidyalaya, editor of Akhand Jyoti, and president of Swami Vivekananda Yog Anusandhan Sansthan. Dr. Pandya has initiated a large number of path-breaking research studies in Ayurveda, psychology, and therapeutic benefits of meditation and pranayama. He has undertaken extensive tours in India and abroad and organized large-scale programs to disseminate knowledge about spiritual aspects of Indian culture on a scientific basis. He has participated in conferences and delivered exclusive lectures at Cambridge, Oxford, and Harvard University, as also at University of California at Los Angeles. He has also addressed a joint session of the House of Lords and the House of Commons in London. He has presented scientific aspects of Indian culture to the World Parliament of Religions held in Chicago, USA in 1993 and in Cape Town, Republic of South Africa in 1999. Dr. Pranav Pandya has been honored by NASA as a distinguished scientist and reformer in 1996. He was conferred with the Hindu of the Year award by Federation of Indian Association in 1999. He has also been honored with the Lifetime Achievement Award at National Symposium of Science of Holistic Living by Sevagram Vardha. As global head of Gayatri Pariwar, he has established branches in 80 countries. His untiring effort has resulted in establishment of a unique university of Indian culture called Dev Sanskriti Vishwavidyalaya to promote Indian values, ethos, and culture. Dr. Pranav Pandya is a shining example of a holistic, purposeful, selfless life lived in the true Vedic spirit. Without any further ado, may I now request Dr. Pranav Pandya to enlighten us on the subject of stress management.
Let me start my presentation. It's a totally new light on stress management as per the military environment, and it applies to all of you. It applies to whole army. It applies to the whole air force. Anybody who is working for the defense of this country. Let us go to the next slide. Stress, what is the definition? Stress is a non-specific response of the body to any demand made upon it or to an external stimuli. Any stimuli from outside or any stimuli from inside. If it is there, then definitely the stress will come and stress will haunt you. Stress will cause many side effects. The stress can also be generated from within by hopes, ambitions, fears, expectations, beliefs. A lot of people have expectations. My children have expectations. My officer has expectations. My neighbors have expectations from me. And my citizens have expectations from me. This leads to stress. I am in stress because I am not coming to the expectations of the people. Beliefs are also one of the important cause of this. Everything that deprives a person of purpose and zest. What is your purpose? What is the aim of your life? If it deprives you and leaves him or her with negative feelings about self, with anxieties, tensions, and a sense of loneliness, is stress. I am just defining various definitions I am giving to you so that you can be very clear about it. What is stress? Stress is just like bending the pin. Keep on bending the safety pin, a point will come and it will break. because metallurgy, this stress word has come from metallurgical engineering, and metallurgical engineering says that a point comes when the stress is severe. That stress which breaks you from inside outside is very, very severely harmful. I started delivering lecture in 1984 on stress. Then many of the people told me, Doctor Sir, you are very young, you are right now delivering lecture on stress. We Indians have no stress, we Indians are very happy. Now after about 20 years, when I see everybody delivering lecture on stress management, I realize that I was correct at that time. I was trying to make them beware of a very, very big epidemic which is going to happen, and it has happened in all the corporate world, all the concerns, all the officers. This is very common, and when I speak about that, and many of the people they tell me that you are telling whatever you are telling is right. As the fishes leap, the salmon fishes leap and struggle stream. You can see this particular salmon fish which is leaping, and upstream to spawn their levels of cortisol surges, providing energy to fight the current. But the hormones also leads to the salmon to stop eating. It starts fasting, and their digestive tract starts withering away. Their immune systems break down, and after laying their eggs, they die of exhaustion and infection. Probably they are programmed to die because of this stress. This is what is one thing which I wanted to show you. Salmon fish, the story of the salmon fish, the plight of the Pacific salmon. And this happens only in the Pacific salmon, not in other one. So this is something which shows that if you are constantly put to stress, you ultimately die. You ultimately fall prey to various disorders. Salmon cannot help being stressed out. They are programmed to die. Their systems propelled into overdrive by evolutionary design. The evolutionary design is like this, that they are supposed to die because of the overexhaustion, and they want to come on the surface. Ultimately, by the time they come upstream, they get tired, fatigued, and ultimately they die of overexhaustion. Similarly, human beings are also now today trying to achieve something which is impossible, and ultimately they are becoming programmed to die. This is particularly one example which I gave you. Man-made disaster. This particular stress is a man-made disaster. Humans, on the other hand, are usually subject to stresses of their own making. The chronic stresses, continuously onslaught of stresses happening on us, like various stagnation in the promotions, various problems happening in the house, various tragedies occurring in the house, visits to hospital, headaches, migraine, all these things causing a lot of problems. Primarily the psychological pressures of modern life. We are living in a very, very modernized life today. Whatever I passed out in 1975, my MD in medicine, and after that I went to USA and I saw the life there also. I feel that in last 15-20 years the lifestyle has changed totally. We are totally westernized, and being westernized, we are losing our culture. Gradually we are losing our culture, and this particular modern life pressure is too much. Multiplexes, malls, cinema houses, the various luxuries, all these things, they haunt us. They haunt our children also, they haunt our grandparents also, grandchildren also. Ultimately they ask for something, and then we have to do it for them. These things, the lifestyle has become such that ultimately we people are falling prey to these pressures, and these pressures are causing a lot of harm. These pressures should not haunt us, and we should try to adjust with them. As most of us now know, that stress is a silent killer. Stress doesn't show that it is there. There is no diagnostic a tool for stress. It is only one diagnostic tool, is the side effect, the effect of the stress. The effect of the stress is on blood pressure. Stress is of the effect on the obesity. Stress effect is on the diabetes. All these diabetes, blood pressure, stroke. All of a sudden, you listen about a person that he died of cardiac stroke. All of a sudden, you learn about a person who died of a cerebral stroke. What happened to him? Stress, chronic stress, superadded by the acute attack. And these things, they are happening today very frequently. Is it this modern lifestyle, is it a bane or boon? But its purpose was not always so. Its purpose originally was to save us. The stress was to save us. It saves a zebra in savanna. You must have seen in the Discovery that there is a zebra and a lion is following him. But in those 3 minutes of screaming terror, he survives because he runs, keeps on running. Adrenaline is running very fast. Stress during birth saves a baby. The crying of baby. You see, the cry of the baby is a life-saving thing. If there is no cry, a doctor says there will be brain death. Brain centers will be dead. And there may be a cerebral palsy. There may be paralysis of the organs. So, the baby should cry. The cry of the baby is for inflation of the lungs, so that lungs get inflated. The cry of the baby is for the heart's various orifices to be closed. The cry of the baby is for making the baby independent, because the umbilical cord through which it is connected to the mother is cut, and now it is independent. So there is no blood circulation coming from mother. So the cry of the baby is just like one first stress in the life, which he or she cries, and that cry is very, very important. If the baby doesn't cry, everybody starts patting the back, everybody starts sucking the fluids from the lungs and the throat and other places, and ultimately they make him just upside down, and then ultimately the baby starts crying. The cry of the baby is a very, very pleasant word to listen for the children. This is something which is the first cry. When the first cry is coming through baby being born, then if throughout life you start getting similar type of stresses, why should you worry about that? You are born with a cry, so the cries will be there. Just try to adjust with it, cope with it. Coping with the stresses is very important. This is something which is very important. Wrong choices. What once helps us survive has now become the scourge of our life. This has become such a scourge of our life that what once was saving us, it now is killing us, because of the adrenaline being secreted, because of the various hormones being secreted. And these hormones, cortisol and adrenaline, they cause various damages to various organs, especially the chronic one. Why? There is a question mark. They sustained stress, our inability to cope with it. What is dangerous is not stress. Stress is not very, very dangerous, but our response to it is very dangerous. And the response to the stress stimuli is leading to the various side effects and various problems which are causing various damages to the organs. The organs are being damaged, and ultimately they are falling prey to disorders. No doctor will tell you that you are suffering from stress. They will tell you are suffering from such and such disorder. Nobody will tell you that it is because of stress. They will just tell you, just take care of your stress. Don't be in stress. Now, they don't tell you how to manage that stress, how to manage it. There is one disorder known as PTSD, which I want to tell you, a psychiatric disorder that can occur following the experience or witnessing of a life-threatening event such as military combat, because we are talking about army. Military combat, natural disasters, as it happened in Kedarnath. About 12 of our army personnel, they died in the helicopter crash. They were saving the humankind. Terrorist incidents in which you are put to the risk, serious accidents, or physical or sexual assault in adult or childhood. These are the causes of PTSD. PTSD, I'll just carry forward through 3-4 slides more. Post-traumatic stress disorder, armed forces are exposed a lot to the situations which may give rise to PTSD. Armed forces see lot of terror, a lot of people, lot of friends. He was talking to me just 2 minutes back and he died in front of me. Lot of time you must have heard this word from the army. You are from the strike corps. The strike corps knows this thing very well, that in strike corps you are facing directly the enemy in the front. Ultimately, you see many things which are happening in front of you. Most survivors of the trauma return to normal given a little time. If you just give them a time, little time, or a psychiatric support, they return to normal. However, some people will have stress reactions that do not go away, or may even get worse over time. So we should try to be aware of it. We should try to be knowledgeable about these things. These individuals may develop PTSD. These individuals in later part of their life may be retiring with PTSD, post-traumatic stress disorder. You don't know about the Iraq war and you don't know about the Afghanistan war. A lot of Americans are getting psychiatric therapy. About what I know is the figure in the Journal of American Medical Association, JAMA, about more than 1 million American soldiers are getting treatment for PTSD. Can you imagine? This is because of those people who went to Vietnam, who went to Iraq, and who went to Afghanistan. All these people, Iran, these people all are suffering from PTSD. They need treatment. People who suffer from PTSD often relive the experience through nightmares and flashbacks. Flashbacks starts happening. Whatever they saw, the view, the reasoning is not there. So that comes in the view, in the dreams. They have difficulty in sleeping. They take pill and they just sleep. They don't get sleep. So they take another pill and they sleep. Feel detached or estranged. They, despite the love and affection from the wife and from children, from the parents, they don't feel a companion, but they just find themselves detached. They have been observed in traumatized troops, which form the basis for various somatic symptoms. Psychosomatic. Psycho means psychological pressure, and somatic means physical, means our body symptoms. Middle rank officers as compared to soldiers and junior commissioned officers are found to be more vulnerable and stressed out. This is just my study. As per my study in my psychiatry, I have studied that middle rank officers are more vulnerable. Main causes of stress in soldiers: professional, social, financial and domestic pressure induces stress in soldiers, which are psychological effects of low intensity operation characterized by restriction in the use of weapons and techniques. This is because of that reason. Second is unpredictable factors such as battle fatigue. They get tired in the battle, extended field tenure, didn't get vacation for a little amount of time, denial of leave when required, unplanned travel, and children education. What will happen to my children? Third, the important point is shortage of officers. We are not getting many people coming to the army. I don't take my words seriously, or just understand the problem sincerely, that there is a problem for which we have to bring awareness in the masses, that we need incarnation are of 3 forms. Avatar 3 प्रकार के होते हैं. Incarnation, Sant, Saint, Sudharak, the reformers, and third is Shaheed, the army soldiers. We need army soldiers for the safety of any country, and if these are in scarce, if there is a scarcity of these people, then who will protect the country? We are sleeping comfortably because the army is protecting us. So we are having shortage of soldiers, officers. Extended tenure in counterinsurgency, whether it is Mizoram or whether it is Naxalite area or whether it is Jammu and Kashmir, high altitude like Siachen. Interpersonal relationship between officers, JCOs and soldiers is also one of the reason, and inappropriate response from civil administration to resolve domestic problem. Lot of problems could be solved if civil administration could help the army in cohesive attitude, but they don't do. Sometimes it is because of that, the IAS ego versus colonel ego, and this is what is happening. that why should they administer us? We are the administrator, and this is the big problem. Reporting appraisal be transparent between field and peace tenure. In the field tenure and the peace tenure, there should be proper collaboration, and there should be a transparency between the two. Non-availability of quicker appellate mechanism. If there is anything wrong, the appellate mechanism should be very, very good. It should be very quick. And the social apathy from society. So society is not very much aware of it, that what pains you are taking, what pains army is taking to protect the country. And then the humiliating remarks on the soldiers who are devoted to the social duties, civil defense, protecting you, all of us, from the the terrorists and other things. These things are happening. So these are the things which are very common main causes of stress in army personnel. Main causes of stress in soldiers: poor leadership. Joining army is the last priority of a capable youth. I ask many people, why don't you want to become teacher? No sir, I don't want to become a teacher. Don't you want to go to army? No sir, no army. I want to become doctor. I want to become engineer. I want to become manager. I want to become a topmost position in the corporate world. This is what is happening in last 15 years. In last 15 years, this particular thing has changed. Reluctance in seeking psychiatrist help by soldiers. Soldiers are many times reluctant in going to psychiatrists. They think that they are being taught as a patient of psychiatry. No, they are not. And lastly, the retiring blues. The retiring blues, after retirement, what? These retiring blues are very common, and this is because of that reason, that the army people are very much vulnerable. PTSD: while the individuals with depressive tendency are more prone to commit suicide, the individuals with aggressive attitude suffering from chronic stress are prone to commit fratricide. This is something which is you must know. There were as many as 635 cases of suicide, including attempted suicide, and 67 cases of fratricide, homicide, killings in 3 services of armed forces during the year 2003-2007. Now I will try to give you a latest data, which Indian government has given just day before yesterday, and that has come as a boon to me. 597 military personnel have committed suicide in last 5 years. Government says this rate is less, but as compared to 007 to 013, 03 to 07 and then 07 to 013 is a much lesser, but 597 military personnel committed suicide in 5 years between 2009 and 2013. Disclosing these figures in the Rajya Sabha on Tuesday, Defence Minister said that the government has taken various measures to create an appropriate environment for defence personnel so that they can perform their duty without any mental stress. We need to have a very good psychiatrist, as well as a yoga therapist, as well as a spiritual scientist who can understand the problems of the soldiers and who can prevent the suicides which are happening in the army. Initiatives of Dev Sanskriti University, which I am Chancellor of that, and what we have done is that we are training various army personnel. We have gone to Siachen also, and we have gone to the various higher ranges in the Himachal and the Uttarakhand region, and we have trained them in pranayama and yoga and various things. 30 days duration, each session lasting 1.5 hours, and ultimately these people have become very much controlled, composed, relaxed, and this is particularly very good thing. The program consisted of an integral yoga practice which included asanas, pranayams, prayers, Onkar and Gayatri Mantra, and Yoga Nidra, and a sample of 60 army personnel was taken, ranging from the rank of Jawan to JCOs participated in the study. The participants completed the standard self-reported occupational stress index test. I'll try to send this stress index test to Major General Sahab, who can distribute it to his subordinates, all the JCOs, all the army personnel, the majors, the captains, the colonels, the brigadiers, so that they can just fill their stress audit, and then after that we can think about how to address them in future. Result revealed that participants experienced a statistically significant reduction of stress at workplace. This is what is the result of the yoga which was introduced. The findings suggest the beneficial effect of yoga as well as yoga-based intervention in the management of emerging occupation-related stress. This is what is the very important thing which I have found. With proper understanding of stress mechanism in soul, mind, body relationship, stress can be coped. Soul, mind, body. These are the three things which are associated with each other. If we try to keep them in cohesion, then we can cope with the stress very properly, the emotional interconnect. How stress originates? You can see there are roots, you can see this is particularly the roots. The moral values are the roots, the mind is the trunk, and the branches are the body. What is happening? The doctors are watering only body, that is branches. They are not giving any consideration to the roots, and this is particularly very important, which you have to understand, that this particular thing should be taken as a whole. Not mind that the stress is not an abstract concept that you should do something about someday. You need to attend to it now. You should attend to it now, coping with the stress. There are two types of stresses: constructive stress and destructive stress. Constructive stress and destructive stress, I'll just tell you, eustress is constructive stress, distress is destructive stress. There is another one, short-term stress, acute, immediately it came. I remember one of my patient who came from Bhopal, and he was a general manager of purchases, and he developed within 24 hours of learning that he lost money in the shares, and he immediately became diabetic, and he went into diabetic coma. Within 24 hours he died. I just don't know any of these cases, but then these cases started happening very fast. Long-term stress is chronic stress, and this stress is sustained stress, continuously, constantly it is happening. Stress experienced and coped. Eustress, you can see activity tension cycle, up and down, the cycle goes on normally, rhythmic cycle. Ups and downs are very common in our life, so they will come and they will go. But the another one, improperly coped stress leading to catastrophes, is high activity, too much activity, tension, and depletion of energy. Too little activity, tension, depletion of energy. These are the two extremes, and because of these, you can see the graph, you can see this particular graph. This graph will go on like this, and this graph will go on like this. This will go on increasing, because of the too much or too little activity. The mechanism of stress is, it involves the cortex, hypothalamus, autonomic nervous system, neuromuscular system, hormonal system. These are the whole body is involved in this stress. The stress situation is adrenaline, glucocorticoids, heart rate, blood pressure. Because of these two hormones, the heart rate and blood pressure rise, respiration quickens, oxygen flows to the muscles, and immune cells prepare to rush to the site of an injury. Ultimately, they try to repair it. This is what is the course of events happening in each and every one. Now, prolonged or severe stress has been shown to weaken the immune system. The immunity goes on getting weaker and weaker. It strains the heart. It puts strain on the heart. It damages memory cells in the brain. A lot of people with sustained stress lose their memory gradually and deposit fat at the waist rather than the hips and buttocks. You see, you can keep on accumulating fat on the back or the hips, buttocks, but if you collect fat on the waist, the half inches of waist means about 5 or 10 years of life are lessened. It is very, very important that your waist, whatever you eat in the haste makes your waist. You understand my point? Whatever you eat in the haste, HASTE, makes your waist, WAIST. It goes here and gets deposited. A risk factor for heart disease, cancer, and other illnesses. Psychoneuroimmunology. Psych affects neural system, which in turn influences immune system, and immunity goes down. Immunity is our vitality. Immunity is our regular response to anything which is happening, like pollens, like various viruses and other things. Immunity gets stronger, but if this immunity gets weakened, then we succumb to the illness due to stress. Even straightening out of the chromosomes by erosion of the telomeres. This is something which is very important. If you, any of you is a scientist or any of you is a medical scientist, the telomeres are the protective layer on the top of chromosomes. They get withered away. They get torn up. And this is because of the chromosomes being affected, the whole heredity being affected. And ultimately, you start getting the beginning of the cancer. So, stress, constant stress can lead to cancer also, and many other problems. It is not stress per se, identifying stress, that is harmful, rather the problem associated with stress resulting from complicated interaction between the demands of the outside world and the body's capacity to manage it. There is a burnout stress syndrome. Many of you must be worried about the word boss. Boss has come. Boss has come. Boss is nothing but burning out stress syndrome, a debilitating psychological condition brought about by unrelieved work stress. I am just underlining the word unrelieved. It is never at relief. The person is never at relief and continuously in stress. There are 5 stages of the boss: honeymoon stage, fuel shortage, chronic symptoms, crisis, and losing the marathon. I will just explain you. What is honeymoon? Honeymoon is initial euphoria. You are very a young lieutenant or young captain comes and he starts planning many things, and he ultimately, his habits are spoiled. He starts taking tea late at night and he doesn't get sleep properly. He starts taking sometimes liquor, sometimes he starts smoking. Fuel shortage, depletion of energy. Energy gets depleted. Fatigue, insomnia, and escape activities. These are the escape activities: smoking, taking liquor, and ultimately at the cost of food. You don't eat food, you eat fast food. Chronic symptoms: more fatigue, ailments like ischemic heart disease, irritable bowel, bowel gets irritated, mucus comes out, myalgia, muscle pain, bronchial asthma, peptic ulcer, ulcer in the stomach, and depression. And then lastly, the 4th stage is crisis, pessimistic outlook. Nothing is going to happen. Nothing is going to happen. I have shown to so many doctors, nothing is going to work out. Enhanced anxiety. Anxiety goes on enhanced. Doubts about own capabilities. I won't be able to do it. I will never be able to come out of this particular thing. So ultimately, escape mentality, tension, headache, chronic backache, hypertension, sleep disturbances, hitting the wall, losing the marathon. He sees that the wall is in front. If I run fast, I may achieve it. But he falls, and this is collapse of the executive. This is what is the biggest problem. Now there is another reverse of that, rust out stress syndrome. Rust out stress syndrome is how to get rid from the ROS. Stay alert, take risk, avoid isolation, and stretch for success. Overcome obsolescence. What is happening today is we are becoming obsolete in this world, and to get rid from ROS means getting rusted out, and because of the no work, or because we are unable to select work for us. This is what is one of these important syndrome. Stress signals, early symptoms. When you start getting early symptoms, like for no reason, stomach upsets, you didn't eat anything, but your stomach upsets, belching and other things, headaches, rashes on the skin, back pain, and insomnia. Many times you just don't get proper sleep. Nervous reflexes are biting nails. You must have seen the cricketers biting nails. Anybody who is in stress, he bites his nails. Doing 2 jobs at a time. You are shaving also, and you are drinking cup of tea also. In your stress, you put your brush in the cup of tea, and what is the shaving water? You drink that water. This is what is 2 jobs at a time. Don't do 2 jobs at a time. You are you are studying, you are reading newspaper also, and you are eating your dinner also. This is wrong. Do one thing at a time. First read the paper and then eat, or eat and then read the newspaper. Grinding the teeth, picking at facial skin, and hunching the shoulders. Illnesses are asthma, migraine, digestive disorders, and skin disorders, For example, dermatitis and other things, and sexual disorders like impotency and many things. Mood signals. Mood signals are anxiety, बहुत ज़्यादा चिंता, lot of worries, depression, you are depressed totally, frustration, you don't know what to do, habitual anger or hostility, and helplessness, I can't do anything, hopelessness, nothing is going to happen to me, and irritability, very irritable, very soon you get irritable, restlessness, you are very restless all the time you are restless, and by your restlessness your subordinates also worried, because they are getting the effect of this. The stressed executive leads to stresses in the subordinates. So we need to have the stress control of each and everyone. Behavioral signs are aggression, disturbed sleep, emotional outburst. We don't know why, but sometimes your emotional outburst is so much that ultimately you just shout. Leaving jobs undone. You just leave the job for tomorrow, but that tomorrow never comes. Overreactive. You are overreactive for anything. How to manage stress. Now we come to the last part of it. That is the how to manage stress. That capacity can be influenced by heredity, by your parents, by your father, mother, the sanskar, all those things. Childhood experience, by diet, change in the diet, exercise and sleep pattern, changing it, by the presence or absence of close personal relationships, your wife, your father, your mother, your children, your granddaughters, by income level and social status, and most importantly by presence or absence of higher and noble aims and ideals. Start having some noble ideals, noble achievements which you want to get in the future, which you want to get in the afterwards. So start having an aim for your life. Allostasis. When the stress situation is over, another complex set of adjustments calms things down, returning the body to normal. This process of equilibrium through change is called allostasis, and it is essential for survival. So stress itself is not very harmful. Stress is very important. Stress is necessary for life. Without stress is just like a spice of life. नमक मिर्च चाहिए अपने को खाने में, तो just like that stress is needed. Stress makes you active. Stress makes you very virile, active. So you should try to take that stress. The menace of the stress is we turn on the same stress response designed to save us in life-threatening situations. And thinking about mentally eating on someone or getting eaten by someone, and we are doing it non-stop. Taxes की problem है, सब कुछ है. We are already worried about that, and these things they keep on coming. Concept of stress was in Indian philosophy also. Our rishis and sages long ago had the knowledge of killing nature of sustained stress, and they called it klesh, santap, and their adverse effect on the mind body were well known to our ancestors. So our rishis, our sages, they knew it, and they mentioned it in the Upanishad, various scriptures. Even Goswami Tulsidas ji has mentioned it in Ramayana. Moh sakal vyadhin kar moola, tehite upajai bahuvid shula. Right from the attachment to something, you start getting the stress. They devise methodology to cope with them. I will be discussing few of these techniques. Knowledge of the body's reaction to perceived stress. You must know about it. You read books. Knowledge of mental, physical, emotional and spiritual factors associated with stress. The regular practice of relaxation techniques. How to relax yourself. Every day try to relax for 15 to 20 or 30 minutes. Try to do it in the office. Just relax for a power nap. You can take 15 minutes, 10 minutes, just timed, and that power nap will give you energy for next 10 hours. The periodic evaluation of effectiveness of your coping skills and relaxation techniques. This, if you keep on doing it and you evaluate it, then effective stress management can be done. Keep in mind, I cannot and should not be cured of my stress, but merely taught to enjoy it. I have come here to not warn you, not make you afraid of stress. I come here to tell you that complete freedom from stress is death. When will stress end? When will it end? It will end after death. This is very true. Stress is going to be throughout your life. So try to learn with the stress. Try to learn with living with the stress. Ideally, a wholesome life includes the combination of upasana, sadhana, aradhana. Upasana means sitting in the proximity of Almighty. Qualities, ideals and virtues is Almighty. Qualities, good ideals, qualities, to imbibe them in day-to-day life. Do it 15 to 20 minutes. Meditate. And sadhana. Sadhana means managements, time management, resources management, sensual desire management, and your thought management. These are the 4 managements. Aradhana means service to society. Try to give something which is your privilege to the society, and you should try to give it back to them. Change of perspective towards life. Recognition of divinity. Recognize the divinity which is within you. Continuity of life and birth. Remember, Lord Krishna says in Gita that birth and rebirths are very common. So we should not worry about our death and many things. If this life is gone, next life will come. Faith and devotion towards higher aspects of our existence. And then general tips are: take prescribed medication as directed by your physician. Get enough sleep and rest. 8 hours sleep is very important. Drink enough water, about 4 to 6 liters of water in 24 hours. You will say, oh, that much? Yes, even in winter, take it. Your kidneys will be washed and you will be all the time full of fish freshness. Avoid smoking or relying on alcohol or drugs to feel better. Don't smoke and don't take any drug. Don't rely on the alcohol. Build a support system. People who listen, people who can listen to you, your wife, your friends. Journal to express yourself. Write down few columns, blocks. Think and speak positively. All the time being positive. Negativity out, positivity in. Keep your sense of humor. Always keep your sense of humor. We just have forgotten how to laugh properly. We don't know to maintain the humor properly. We don't know how to maintain it. We can laugh on others, but we cannot laugh on ourselves. Can we maintain the humor positively? My Gurudev, Pandit Sri Ram Sharma Acharya had a real, indeed sense of humor, and he used to sleep only for 4 hours, but his 20 hours used to be very strong, full of the power and full of energy. And he taught me for 12 years how exactly the life should be lived. Stress proofing your lifestyle. Change your diet. Tryptophan rich food, vegetarian diet. Take sprouted pulses. Take whatever is tryptophan rich. Besides daily drills, subtler exercises like asanas, postures, and pragya yoga. Pragya yoga is a combination of this Surya Namaskar and various meditational practices. Breathing exercises is pranayam, and proper reading habits, self introspection. If you want, if my general sir wants, I can send my yoga students here to train the people for 3 days, 4 days sessions, and there will be 3, 4, 5 days sessions. So by that many people will learn exactly how to do it. Breathing exercises like pranayam, proper reading habits, self introspection, and proper meditation upon flame, ocean colors, and ragas, and music therapy, mantra chikitsa. Try to meditate on the mantra, whichever mantra is. You can meditate on the Guru Granth Sahib. You can meditate on the namaz. You can meditate on the anything which is pious, any religious, and which gives you positivity. You can meditate on Ramayana. You can meditate on Gita. You can meditate on Gayatri Mantra. Avoid isolation. Become part of society, and devote time to avoid for social and selfless service. Don't become obsolete in this world. This world needs you. Awaken inner strength by pranayam and meditation, exercise. These are the 3 things. Meditation, exercise, which is the proper thing, then breathing properly, meditation and exercises, yoga. Pranayam is breathing exercises, key factor in determining lifespan and proper oxygenation of the blood. If you do 10 or 15 pranayams per day, I think that will give you immense strength. Every day, regularity, continuity, without bothering what influence it has in me. Importance of yoga is a system for healthy living through body and breath movement. JAMA is one of the very important magazine, which is my pet magazine, Journal of American Medical Association. Lifestyle heart trial. Yoga may lead to regression of coronary atherosclerosis. Coronary heart disease, the heart disease which happens by the coronary artery sclerosis, it can be lessened by the yoga, they say. Stress and meditation, one of the major causes of stress is incoherency of thought. And incoherency of the thoughts is mainly due to lack of noble ideals and the aims. Meditation takes us on an inward journey. Meditation means inner cleaning, inner journey, and bridges that gap between thoughts and establishes a conscious contact with the creative energy of life. During meditation, the body gains a state of profound rest, which is very important. At the same time, the brain and mind become more alert, indicating a state of restful alertness. That's why the meditation is very important. Meditation, I take meditation classes every Thursday in my university, and one meditation class and one Gita class, which is related with many other scriptures. During sleep, the oxygen consumption drops by 8%, but during meditation, it drops by 20%. Can you imagine? This is perhaps the very, very important, because oxygen consumption less, your life is more. Meditation is the only activity that reduces blood lactate, a marker of the stress. Meditation brings together all the energies of the mind and focuses them on a chosen point. Streams of positive thoughts. Start learning to live in the positive thoughts. Deity, your own deity, whatever is your Guru Nanak Sahib's photo, or Mataji, Vaishno Devi Mataji's photo, or any photo which you believe that gives me vibrations. Flame, Deepak, Diya. Fragrance, the flowers, you can have jasmine or you can have roses and anything. These are the chosen points. Achievements of meditation are enhanced memory, muscular relaxation, and mental equipoise, inner calmness. From inside you are calm, increased awareness, you are aware about surroundings, cheerfulness all the time. You don't find any more cheerfulness today. You find only air hostess smile everywhere. Everywhere there is that smile present. The inner smile is not there. That cheerfulness all the time. Disappearance of jealousy, behavioral modification, a cleanser of our mental garbage. You see, we are living in a garbage-oriented society. So we need to cleanse our garbage which is inside us. And this garbage is hatred, jealousy, lust. All this garbage has to be removed. It gives relief from mental constipation. And mental constipation, we remember about physical constipation, but we never remember about mental constipation. How to do it? Sit in a comfortable position. Classic posture is cross-legged on a floor or big chair with a soft cushion. Straighten your spine, breathe deeply through your nose, inhale to fill up the lungs and then exhale slowly. And gradually meditate on a point, on something which is very, very creative, which is going to be very positive. According to the science of acoustics, the patterns of sound waves produced by each of the 24 letters of the Gayatri Mantra are very special, and their combined effect is a source of immediate energy. My research has been mainly on Gayatri Mantra. Om Bhur Bhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. This is one of the most important mantra of the Vedas, and Veda originated from the Gayatri Mantra. So this is particularly one of the mantra which has got so many consonants and positive vibrations that ultimately it gives you immense energy. The nerves connected with the components of the vocal cord, tongue, palate, fingers, they are more than having 60% representation in the cerebral cortex. And the bioelectrical currents, they are produced more effectively. Balanced diet, new salad combinations, fruit, nuts and raw vegetables, try them every day. Raw or steamed boiled vegetables, try them. Thoda sa le lein, little bit, and rest of it you may eat anything. Fiber-rich diets like brown rice, like you can take anything which is fiber-rich. Whole wheat flour, boiled rice, beans and pulses, potatoes with the skin, small potatoes with the skin, they are very good. Fruits as alternative to pies, and sprouted pulses, wheat grass is very, very important. Living with healthy, anno vai mana. What is your eating thing? It makes your mind. So try to be very aware of it. Man being herbivorous, Westernism leads to right growth. Start taking charge today. We hope that by the end of this seminar you will have learned how to recognize your stress signals, how to use practical tools and practical steps to improve your overall lifestyle. And as I told you about stress log, that stress log, assess your levels of stress every month and try to use these techniques and tips to to help you relieve stress. This is my headquarters where I live. You can see this is Ganges, which is flowing from there. Now there is lot of globalization. A lot of buildings have come up in that area, but this photograph was taken about 7 years back, and you can see this whole ashram is on this side is highway, and this side is Delhi, this side is Himalayas, and here is my university. This side is my university. I'm just showing you to invite you to come there and to enjoy the stay there. 10,000 people can stay at a time. You can come and enjoy the various things. And people have been coming from various military and environment also. Organic extension of Brahmacharya Institute is my university. This is my university for research and study of ancient Indian sciences and spirituality. And this is my another angle of my university. And you can see this is between two hills. So that's why the Garhwal Hills and the another is Shivalik Hills. This is known as Dwar, Haridwar. That's why it is known as Haridwar. We are on the border of the Haridwar district and Dehradun district. This is me. I am taking classes on Gita and Dhyan, and you can see the girls doing yoga, prayer, meditation, community services, yajna. All these things are very common. They done, and there are about more than 3,500 students there, and we are hoping to open various centers all over the country, and various branches of the university in all over the country. Key to perfect living. Last slide. Emotion, thoughts, rationality, and compassion. If you can lies between these four things: your emotions, your thoughts, thinking process, your compassion, your love and affection to the others, and your rationality. By being rational, you become a real good thinker. These four things have to be properly symbiotic. If these four things are combined together, then by this scientific spirituality setup, you can become a proper stress organizer, and you can tell other 10 persons also how to control their own stresses, how to manage their stresses, how to perform the stress management workshop. You also can start doing your own stress workshops by learning this. I'll be giving this presentation to Major General Saab, and he can distribute it to all of you, and he can start running it. Thank you very much for listening to me.
Respected Dr. Pandya, ladies and gentlemen, we are indeed honored today to have in our midst such a luminary who has devoted his entire life to this process of spiritual medicine. Dr. Pranav Pandya has really humbled us and illuminated us with his thoughts on stress management. This stress management is associated with us in our daily lives as soldiers, and he has rightly identified the causes of stress which take place in a soldier's life. Sir, we are indeed grateful to you for this and this very, very illuminating talk, and also we will take on the offer of learning yoga from your instructors so that it could benefit our soldier society and also our children of the future. On behalf of the Corps Commander, I would take this privilege of presenting you a small memento from our side as a token of respect and the time you've taken to be with us. Indeed grateful, sir.